Hello, anatomy colleagues. This is Dr. Alsop, and we have reached our last video in terms of the muscles of the upper limb, and we're going to focus on the muscles of the hand. And so, obviously, we just talked about a lot of muscles that are going to affect the joints of the hand. So these long tendons from the forearm. What we're talking about here are the intrinsic muscles of the hand. So muscles that have both their proximal and their distal attachments all within the hand. And we're not going to talk about all of them. We're talking very big picture here and some of the highlights. And we're starting with the compartments on the lateral and the medial side. So you're going to have, if you look at your own hand, generally you have a fairly prominent bulge next to the first digit and then one next to the fifth digit. This one next to the first digit is referred to as the thenar compartment. These are going to affect the motions of the first digit or the thumb. And then the hypothenar is going to affect the fifth digit. So it'll have muscles that will directly move the fifth digit. And so this thenar compartment is going to be innervated by a branch of the median nerve, which is actually unique because most of the muscles of the intrinsic hand are going to be innervated by this ulnar nerve. So thenar is a little unique in the fact that it's going to be uniquely innervated by the median nerve. In fact, it's going to be innervated by a branch that traverses the carpal tunnel. So if you have some type of compression within the carpal tunnel, it could feasibly affect these muscles in the thenar compartment. And this hypothenar compartment here is innervated by the ulnar nerve. You actually have I just said it was unique, and I'm going to talk about another set of muscles where you do have that unique setup. So these lumbrical muscles, which are located more in the central palm region, are going to have a separate innervation as well. So the more lateral two will be innervated by the median nerve, and the medial two will be innervated by the ulnar nerve. Pretty much every other muscle in the hand, the intrinsic hand, is all or ulnar nerve all the time. And I wanted to mention the lumbricals for one reason. They're not particularly powerful muscles. They'll flex the MP joints and extend the IP joints, okay? But what's neat about them are their proximal attachments. So their distal attachments are going to be on these extensor expansions down here, but their proximal attachments are actually on tendons. They're going to be on other tendons, specifically the flexor digitorum profundus tendons. You remember those are traversing the carpal tunnel to go have their distal attachment on these distal phalanges. Well, these lumbricals, these little worm-like muscles, will actually kind of look like they're coming out of nowhere from these tendons of the flexor digitorum profundus right here in the middle of the palm. And then deep to those lumbricals, you're going to have some other muscles, but one of them that's the most obvious are going to be these interossei muscles. And you're going to have two sets. You're going to have dorsal interossei, of which you have 4. So this is on the posterior side. And then you'll have palmar interossei, of which you have 3. And these, like most intrinsic muscles, are going to be innervated by the ulnar nerve. Now, it does look a little bit like this illustration is kind of flipping you off, which is not the case. What it's indicating is that when we're talking about abduction and adduction of the digits, abduction is going to be away from the third digit. So it's not from the midline so much as the third digit, whereas adduction is adding back towards that third digit. So those dorsal interossei are going to abduct, and the palmar interossei are going to adduct. And you can remember that by this kind of mnemonic here, dab and pad. Additionally, it will assist the lumbricals in terms of flexing the MP joints and extending the interphalangeal joints. And so these are probably the deepest of your intrinsic hand muscles. Again, this was not an exhaustive list, but these are some of the more prominent muscles associated with the intrinsic hand. So, tricky trick. All right, which nerves will innervate the intrinsic hand muscles? All right, so read through the answer choices. And then hopefully you have landed on D as the correct answer. So you are going to have, say, like the radial nerve, going to play a role in terms of extension of the digits, but it's only from these muscles here located in the forearm. It's really the ulnar nerve. Ulnar nerve is kind of the main nerve that's going to innervate most intrinsic hand muscles, but we do have some median nerve innervation with this thenar compartment in some of the lumbricals. All right, excellent. We have made it through the upper limb. I will see you in our discussions of the pelvis and the lower limb in the MSK5. Thanks for your time.